So one of the most important things that I discuss with patients at the time of your consultation is what are your treatment options. If we have diagnosed a hernia, there's always the option of watchful waiting. Conservative management is sometimes the best option, especially if the hernia is not causing you any symptoms, it doesn't limit your activities. We can just say, we know you have a hernia, and you can watch and wait. As I discussed in one of the other videos, approximately 50% of patients that do just watch their hernias end up having symptoms form over the course of months and years, which then can come back and have surgery. So one of the treatment options is nothing, just watchful waiting. However, if the symptoms are limiting your activities of daily living, or your sports life, or your work life, certainly we need to intervene. Hernias do not go away on their own. Unfortunately, once that hole in the muscle has formed, no amount of exercise or no amount of rest is ever going to repair that hole. It requires a surgery to fix. The two basic types of surgeries are open surgery and laparoscopic surgery. Both are excellent treatments, and as most doctors would say, there's no one-size-fits-all approach. That's why it's important for me to discuss with you at your consultation your symptoms, your expectations, and what you're looking to do after your surgery. Based on that discussion, we can decide whether open or laparoscopic surgery is the right one for you. Unfortunately, there are no non-surgical or medications that will help treat a hernia. Again, exercise puts more strain and stress on the muscles, and over time will likely make your hernia bigger. So exercising isn't going to cure your hernia. And again, no medications can help the muscle heal. Wearing a hernia truss or a hernia brace can be helpful if you're deciding to just watch your hernia and undergo conservative management. Managing some symptoms or mild symptoms using a hernia truss can be a great idea. However, obviously that hernia truss isn't going to heal the hernia on its own. As I've discussed in one of the other videos, there is always a small risk when you decide to watch your hernia. There's a 1 to 2% chance per year that your hernia can strangulate or become an emergency. Although watching your hernia is certainly a good idea if it's asymptomatic, we both have to understand that there is that small risk. So at the end, I usually defer to the patient. You have to be the one that decides the pros and the cons of conservative management and observation versus proceeding into surgery. There's no other person that can decide how much it's limiting your life, how much it's limiting your sports life, or how much it's limiting you at work. Once you've made the decision to either watch your hernia or proceed with surgery, myself and my office is happy to accommodate your decision.